Hey everybody, this is Robert. It's Friday. I got a notice that I do go to court on Monday, February the 12th at 10:30 a.m. and that's for final revocation hearing. That's when I'll know exactly the amount of time I'm getting. Anyway, I wanted to touch base on something about medical care. I made a comment that I think in my first video I did from here, or second one, about me refusing medical care so long as I'm incarcerated. And let me say something about this. So this didn't just come out of nowhere. What it was is a couple days before the warrant was issued and the marshals came to my house to arrest me, or whatever. I still trip when I think about it. I had been going through material for YouTube, all my old paperwork from prison and stuff like that. And one of the things I came across was my compassionate release brief that I originally wrote to the judge, which then led to me getting out of prison, or the judge released me from prison. And the medical records from Butner when I had cancer and I was fighting with them about trying to have my cancer removed. At the time when I was in prison, my cancer was superficial, or even the tumors. So I want to say that because some tumors aren't cancer, some tumors are, but it doesn't matter if the tumors are cancerous or not when they are invasive. And that's what happened on one of the last tumors right now. So when I originally filed for my compassionate release, my cancer was non-invasive. Now that I'm out of prison, going back, my cancer is invasive. So anyway, here's the deal. I was going over, the judge asked me when I was at my hearing a couple weeks ago, I wanted to deal with my medical stuff on the street or in prison. I said on the street. He said if I was going to use this to get high or to drink or do drugs or whatever, that he didn't want me out like that, or asked me if I can, was I going to get high or was I going to drink or something of that nature, and I said I could make no promises. I never made any promises to him or anybody else. So what happened then is I looked at the medical records and I saw the length of time. Oh, that's what I wanted to say. The judge asked me how long it was going to take the Bureau of Prisons approximately to get me, if he was to put me in prison a couple weeks ago, how long would it take to get the cancer dealt with? And I said I believe my answer was about 6 months. That's right on the money. 6 months is like the low end. I went back and looked at all my paperwork about the cancer. So here's what it is. I was in Butner one time, 9 months, twice actually, 9 months with the cancer in me, and they had not removed it. One time they actually called me and they were shipping me out when my cancer was, my bladder was full of cancer and I was pissing blood. The warden actually caught the transfer. She saw me leaving, stopped it because she knew people from Congress, had a congresswoman and a senator that were calling up there inquiring about my medical condition, and she freaked out because she had no idea how I slipped through the cracks and was being transferred. And again, my bladder was like caked with superficial cancer at the time. So anyway, I'm looking at this now and I'm thinking, I do not want the Bureau of Prisons to give this. I don't want to give the Bureau of Prisons this kind of power over me because it's too stressful. That's where this all comes from. It will take them at least 6 months to get me to a urologist and get me diagnosed, okay? Even if I'm in a medical facility. The medical facility maybe not 6 months, but I'm not going to just pop up at Butner or Springfield. And the chances of that are way high. Low that I would do that. But it still takes an amount of time for them to look into my bladder, get back all the paperwork. I think one of the requests for paperwork from the hospital was 6 weeks to 12 weeks. I believe I filed all that to the judge in my original compassionate release brief. And so my point being is this. I know now that my cancers, or that my tumors have entered my bladder wall, that there's about a 6-month window where I'm supposed to be scoped every 3 months from now, probably for the next 5 years, okay? Refusing, of course, I'm not going to be getting scoped the whole time I'm incarcerated. But if I go in there and I start fighting to get scoped and it doesn't happen, the stress that it's going to cause on me is way freaking worse than anything. So I will take the gamble and I will go ahead and do the year in prison because I'm not going to be getting a halfway house. I will go ahead and do the year if that's assuming that I get the 14 months. It could be higher or whatever. But that's a decision I made. And as a matter of fact, when the marshals came and arrested me, they asked me what medications I wanted, and I told them none. I'm not taking any medications. I refuse medications in the jail. I'm going to refuse medical treatment when I get down to the BOP. I want to go care level 1, which means that I want to tell them I have no medical problems, but I don't think I can. It's on record that I'm a care level 3, so I don't think that the judge I don't think the judge has the power right now. Actually, it's the Bureau of Prison that has me as a care level 3, which means that I have medical conditions. I have a medical condition that requires urgent care. That's what that means. But urgent care means nothing to them when you get into BOP. And in case you guys don't know, the Bureau of Prisons right now has serious, serious problems. They are, for the lack of a better word, clusterfuck. So I just wanted to explain that part of it. I'm comfortable with 6 months not having a scope. I'm sure it'll get a little edgy after that point. But that's a risk I'm willing to take, because I just don't want to be caught up in that freaking machine and have to deal with those people, meaning I don't want to have to deal with the fact that they'll deny me, or they could deny me, or, there's no way I'm going to get bladder cancer. There's no way I'm going to get chemo. Absolutely. That's a joke. That's never going to happen. And I went back, looked at my old medical records, and looked how hard I fought to get what I got myself through cancer. I pushed to have my medical treatment taken care of while I was in prison, and it was half-assed at best. Good doctors. There are some good doctors. It's the system that is totally fucked. So I am going back to prison for addiction, for being an addict. I am going back to prison now worse off medically than I did when I was released on compassionate release, which is kind of a little, whatever. But it is what it is, and I'm okay with it. But I did want to explain that decision. I am doing it because I don't want to deal with the stress of the Bureau of Prison. I just don't want to do it, and that's the way it is. I will say that here, I refused from the gate that I didn't want any pills. I didn't want any heart pills, blood pressure pills, or anything. And they did come within like 4 days to try to bring me medicine. But I'm okay. As far as that. And actually, my last heart my heart stress test showed that I don't have blockages anymore. So, maybe, I hate to put it this way, because I know some people are going to go, what the? Maybe the drugs I did blew those blockages right out of my heart. And I'm being serious, because I've had blockages for 10 years that no longer exist. So, I don't know, man. Maybe there is a little rainbow in this. I have to make light of it, okay? Anyway, thanks for your support. Take care. I appreciate it. Bye-bye.